Many patients have this question. I've got an injured anterior cruciate ligament. Do I have to undergo a knee reconstruction surgery? Just to give you a statistic, of the approximate 2 lakh such injuries that happen in the US every year, only about 50% of them end up having a surgery done. The decision to undergo a reconstruction depends on a number of factors. Probably the most important factor is your activity level. If you're an active individual playing a pivoting sport or a contact sport, then the decision is probably relatively straightforward to have a reconstruction done. Of the remaining general population, about 50% of them cope well without surgery. When I say cope well, they're able to do most of their activities of daily living, like walking, going to the office, climbing up and down the stairs, even a bit of straight line running, swimming, and cycling. So, what the ACL does not allow you to do probably is jumping and landing, sudden change of directions, pivoting, sudden deceleration. So, if you're wanting to do any of these activities, or you're not able to cope with your activities of daily living with an ACL injury, then probably you should consider having a reconstruction done. So the decision to have a reconstruction done is based on many other factors, like the degree of injury, whether it's a partial injury or a complete injury. It also depends on your symptoms that you're having and many other factors. So have a detailed discussion with your orthopedic surgeon before making a decision to have a reconstruction.